Thank you, Mr. Knox. Ladies and gentlemen, today I want to present you some experiences, not scientific results, in treating Gcmaf in combination with amygdaline and other substances. But I'm a practitioner and I'm no scientist. I'm not quite sure if everybody here in the audience knows what amygdaline is. It's called a toxic substance out of the seed kernels of the rosea, which is apricots and other fruits, apples also. It's toxic, but it's only toxic for the malignant cells and not for the cells which are working intact. The combined medication of Gcmaf actually was used in detoxification therapies as well in immune modulating therapies, as according to the status of the automolecular medicine. I'm automolecular medicine and working with high-dosed nutrients, automolecular nutrients, micronutrients. In my audience or in my practice, I've treating patients since November 2011 with Gcmaf. First slide. And since this time, we have treated 103 patients with Gcmaf. There are 62 female patients with an average age of 24 years and 41 male patients, average year 65 years, between 25 and 81 years. And their following diseases, the whole, well, the main package is their cancer therapy. We have had 82 patients divided in 4 stations or stages. The smallest stage was patient stage number 1, only 6 patients you can see. In stage 2 we had 16 patients, and stage 3 14 patients, and the biggest stage 4 46 patients. All cancers you can imagine were being treated since November 2011. Then we had other diseases, and there we had 21 patients. Only 3 diseases. The most astonishing disease was the depression, and it was a lucky point that we find out you can treat depression with Gcmaf, and it's very effective. Acute infections, that's no problem. You can see it's Gcmaf like it works. You may treat acute infections, and this third illness or disease we treated was rheumatoid arthritis. From November 2011 till September 2012, we treated the cancer patients with my own program. You will see, or I will describe what the program is. And in the point of Gcmaf, I gave once a week 100 nanograms subcutaneous, like David Knox says we must do it. And since the September 2012 or October 2012, all patients have been treated in the same way, but they got the Gcmaf intravenous once a week. And then November 2012, there were only being selected patients, and they have gotten the Gcmaf twice a week, intravenous, and with different results. First of all, I tested the Gcmaf, not all my cancer patients with Gcmaf, because I want to see how does it work. Dr. Klinghardt in Baden-Baden says you can heal 80% of your cancer patients, and I don't trust it. I want to prove, and I proved, and there was one patient, I think you remind the patient, it was a female patient, a 43 years old female patient with metastatic breast cancer, with multiple skeletal metastasis. The treatment started in November 2011 with Gcmaf once a week. In April 2012, palliative radiochemotherapy of the neck with a cervical spine was added, and we put up the doses of the Gcmaf to 200 nanograms a week. Today, the patient has no signs of metastasis. TP, TL1 and ApoT10 are both normal. The 25 OHD is 150 nanogram per milliliter. I'm working with very high vitamin D levels. She has clinical no symptoms. You can say you have no signs of the cancer. And on the basis of these experiences, I treat since January 2013 all my cancer patients with the Gcmaf in a special form. In the week 1 to 4, they got the Gcmaf twice a week intravenous. And the next week, it's the week 5 and 6, they get it one a week intravenous, also 200 nanogram. Some persons get 400 nanogram per week. Next. But that only is additional treatment. In my header I said I will explain, or I will describe my experience in treating with amectolene and Gcmaf. Here you can see what other substances we give. We give the B17, that's called amectolene, and B15. You must put them together if you want to treat effectively. The vitamin C, the vitamin D, it's D3, not D2. I'm working except with D3. Vitamin D, selenium, folic acid, the vitamins B1 to B12, the NACC, the glutathione, ornithine aspartate, zinc, magnesium, kalium, chrome, calcium, magnesium, calcium, and some homeopathic substances to modify the body for losing all the poisons you are treating, and the patient always must drink. My basic carcinoma therapy contains amectolene between 9 and 45 gram intravenous. 45 is a very high dosage. And then we detox the organic systems with these homeopathic substances you can see at the end of the list. The idea behind my procedure is to destroy with amectolene the malignant cells and then activating with Gcmaf the phagocytosis of the macrophages and to destroy the cancer cells with Gcmaf himself. What else? Very interesting is another patient, 37-year-old female patient with breast cancer, very small breast cancer stage 1, the tumor about 1 centimeter. She was, there was a surgery and the tumor was eliminated in total and in healthy tissue, but also we had simultaneously about a suspicious lymph node, and they decided to eliminate the lymph node after 4-6 weeks after the first surgery. The patient came to me. She got one single shot, Gcmaf, with 200 nanograms, and the lymph node were eliminated. The sentinel lymph node was too free, and also a second lymph node was without tumors. There were only 2 lymph nodes eliminated by the surgery. No tumor. This person must be declared as cancer-free. Furthermore, another interesting patient is an 80-year-old breast cancer patient, stage 4 metastasis, lung, breast, lung, liver, skeleton. No other methods of the so-called school medicine in Germany are effective. And she came to me. I declared, in the first anamnesis, we spoke about the problem I want to give to her, and in the first session she got 200 nanogram Gcmaf intravenous, and after 4 weeks she came to me a second time and she asked me if she got the happiness injection. She told it my happiness injection, but I don't know what she wanted. I don't give her any happiness injection. She only got the Gcmaf, and therefore I mentioned that the depression was a second diagnosis. She didn't talk about me at the first time. It was away. Also, she has a 5-year-old daughter with a very deep depression and anxiety, and asked me if we should try it. In the case of her daughter, we tried, but there was no success after a week. Then I doubled the dose. She got 250 nanogram, and the next day I got a phone call and she asked me which kind of injection she has got. The anxiety was nearly away. From this time I know there is a very, very hard instrument, or good instrument, to treat patients with depressions. And in this way, a new patient came to me last Tuesday, a 68-year-old female patient with arthrosis in the base thumb joint. She received to me a physical treatment because of this arthrosis, and because there was an inflammatory inflammatory disease or inflammatory activation, so-called inflammatory activation of these arthrosis. I gave her only 100 nanograms Gcmaf intravenous. The next day, last Wednesday, she came to me for the second physical treatment, and at the end they asked me which kind of injections he's got. I don't know where. If they will get this twice, no, every second week. I want to give it her. I don't want it, but please, what was it? I have no depression. The depression was completely away. I have more cases with these depressions, and in this morning I don't have heard any word about the depression and how you can heal. I can heal the depression with Gcmaf. I don't know the circumstances much, but it may be any explanation on this.